All right. So welcome, welcome back from your break, and we're going to continue on and talk about certain disease conditions that you will commonly see with ultrasound that affect the liver. Is everybody good? It looks like there's a couple of people that are still breaking, but can y'all hear me okay?
Yes, sir.
Yeah.
Okay, perfect. Okay, so here's a list of some of the things that you might see. Is by all means, it's not an inclusive list, but it's some of the more common things. And so let's go start running through these, and I'll tell you typically what you see with ultrasound. So kind of the way we've done so far is I showed you here's the way a normal liver should look. Here's the echogenicity, the architecture, the margins, what's around the liver, things like that. And so now we're going to start going into here's how the liver shouldn't look. So disease conditions, and you can compare that to how the liver normally should look in an animal. So here is another part of liver. So this is a cat. So here's liver all down in here. This is another fat cat. So this is all a bunch of falciform fat ventral to the liver that you can see in this area here. So liver down here, don't confuse this as a hepatic mass. That's a big fat cat with a bunch of falciform fat. So in this case, the liver is subjectively, it's really hyperechoic. It's really bright. It's a lot brighter than you would expect to see for a normal appearing liver. And again, that's subjective when I just look at this, but we have that kind of built-in control that we talked about the spleen, liver, and kidney with the order of an echogenicity in a normal animal between those three organs. And so here's another, this is gallbladder inside the liver. So the liver is super hyperechoic. It's much more echogenic than the falciform fat that sits right next to it. And if you would compare the liver here to the spleen and to the kidney cortex, the liver looks brighter than both of those organs, and it shouldn't be. Okay, the spleen should be the brightest. And typically, what you're going to see in a cat that has fatty liver disease or hepatic lipidosis is diffusely the liver will become more hyperechoic. And that's because in that disease condition, you're actually replacing the hepatocytes with globs of fat or lipid inside the liver, which sonographically is more echogenic than normal liver tissue or hepatocytes. And so typically what you're going to see in a cat with hepatic lipidosis or fatty liver disease is a diffusely hyperechoic liver. And the other thing that I kind of always look for is you have decreased conspicuity. In other words, you can't see them as well, the vessels inside the liver. You can't follow them as well out into the liver. Sometimes you hardly see any vessels at all. Like in this part of the liver, I really don't see much in the way of vessels because they're harder to see because the fat attenuates the sound and makes everything harder to see. So what do I look for in a cat with hepatic lipidosis? Sonographically, the liver basically looks diffusely hyperechoic. The intrahepatic vessels aren't as obvious. They're not as well defined. Typically in cats that have hepatic lipidosis, their liver will be normal in size to maybe just slightly enlarged. It's not really big at all. So slightly enlarged to normal in size, diffusely hyperechoic liver. That's typical of a cat with hepatic lipidosis. Now, how do I know definitively what that is? How do I prove it? And the answer to that obviously is like anything else. Next step is we're going to stick a needle in that liver and we're going to get some cells out of that liver and look at those cells under the microscope for evidence of hepatic lipidosis. And then that's probably your definitive diagnosis. Okay, this is in the liver. This is an abscess. Now, an abscess in the liver looks just like an abscess, whether it's in the liver or the spleen or even a subcutaneous abscess in a cat from a cat bite. So abscesses look kind of funky. They look kind of weird. An abscess you can see is this hypoechoic area right in here. And if you look, it looks like it's not totally anechoic. It's got some speckles inside of it. So it's got some probably free floating cellular debris inside that abscess if you're looking at it in real time. And the margins of the edges around the abscess, they're not thin walled. They're kind of poorly defined, kind of thick walled, if anything. And it's got kind of an irregular internal margin. And it looks like it's got this invagination of tissue inside the abscess. Okay. So if you were to put a needle in that and to prove it's an abscess, then the first thing you're going to do is you're going to look at it and at that cell. Most of the time, you're going to get pus out of the middle of it. Okay. So an abscess is usually something that's irregular in shape, thick walled. The inner surface of the abscess is very irregular in shape and poorly defined, and it has floating debris a lot of times in the abscess. Now, think back to pathology, and especially when you're learning about cows and farm animals and things like that. Well, the appearance of an abscess is somewhat dependent on the maturity of the abscess. So, if you have a infection of the liver or subcutaneous tissues and it starts to form pus and become an abscess early on, that's pretty liquidy stuff in there. Okay, but we know from pathology that if you give it time as the body tries to get rid of it and wall it off, then over time, the content in the middle of the abscess will become thicker and green and yellow and stuff like that. And even more time, it becomes cottage cheese like as it dries out. And so the appearance of an abscess will depend somewhat on the maturity abscess. Early on, it might have totally anechoic fluid inside of it. But as it ages, the stuff inside of it starts to congeal and become more echogenic. Okay. But either way, once you stick a needle in that, you're not going to get like water type fluid out of it. You're going to get pus. And if you look at that, you'll see neutrophils, degenerative neutrophils, and bacteria and stuff inside of it. Okay. So an abscess is an abscess is an abscess. Doesn't matter where it is. You look for something that's irregular in shape, thick walled, poorly defined wall, margins, the inner margins of it are irregular and poorly defined with stuff, flocculent debris floating inside the abscess itself. Okay. And an abscess is totally different than a cyst. We mentioned before that anytime you see a cyst anywhere, it's almost always benign, but cysts can become fluid filled and they can get really big. And just the size of the cyst then could put pressure on other organs that live around it and cause failure of those organs just from pressure of the size of the cyst. So cysts, on the other hand, as opposed to an abscess, cysts are almost always thin walled. Okay. They're either oval shaped or round in appearance. Okay. And cysts contain anechoic fluid. Okay. They don't have echogenic debris inside the cyst. And almost all cysts, and this is one of the defining things sonographically of a cyst, is they demonstrate this artifact that you learned about called posterior enhancement. Okay. So if you notice the liver tissue right underneath the cyst right here, that liver tissue is brighter than the liver tissue right next to it. And that is the artifact that I'm sure you discussed called posterior enhancement. Okay. So if I was to define and compare how a cyst appears on ultrasound versus an abscess, a cyst is something that is perfectly round, oval in shape. Okay. An abscess, on the other hand, was irregular in shape and poorly defined. In a cyst, the wall of the cyst is usually very smoothly marginated, thin walled, and crisply defined. In abscess, the wall is thick and irregular and poorly defined. Okay. A cyst is defined as something that is filled with anechoic fluid. An abscess, on the other hand, is something that's filled with flocculent mixed echogenic debris inside that fluid. Okay. And the cyst, in almost every case, the cyst will demonstrate posterior enhancement artifact. An abscess rarely will, unless it's really early on and the fluid inside the abscess is really fluidy or non-viscous. Okay, another weird thing sometimes you'll see, and this usually comes from the dermatologist, or if you're doing general practice, you'll see an animal that chronically will come in and they have these long, very hard, keratinaceous, almost like villi that are extending from the pads of this dog. You can see here's the nail, there's a nail, but between them we have these long villi that are extending from the pad. And these animals, a lot of times, will come in with chronic skin conditions. Can't get that under control. And the dermatologist, as part of the workup, will run blood work, and the liver enzymes are sky high. Okay. And that should tell you up, we need to go look at the liver, because a weird thing that can happen in liver is this and affect the skin is this condition called hepatocutaneous syndrome. And if you look at the liver, this is all liver here, and it looks like there's multiple nodules of various sizes all throughout the liver. It looks really ugly, and there's very little to no normal appearing liver. Even when you fan the probe around to see other parts of the liver, the whole thing has this chewed up nodular-like appearance. Okay, this is pretty rare, but don't be surprised if you have a dog that's middle-aged to older, chronic skin conditions, you run blood work and the liver enzymes are sky high if the liver looks like this. from my understanding, the prognosis of these dogs that have hepatic cutaneous syndrome is really, really poor. It's not a neoplastic condition of the liver, but the prognosis is pretty much the same as if it were neoplastic, really poor prognosis in some of those dogs. If we talk about some common malignant conditions or neoplasia in the liver, there's 2 or 3 different kinds that can happen in the liver that are malignant conditions. In dogs and cats, they can both get lymphoma in their liver, and they can both get adenocarcinomas in their liver, and they can both get a third one called hemangiosarcomas. Again, if you were at Vegas at the radiology craps table and they said there's a tumor in this cat's liver, and the cat's middle aged to older, what are you going to bet? If it's a cat and it's caudal to the neck, you should probably always bet lymphoma. That's going to be the most common one. In a dog, probably hepatocellular carcinomas or an adenocarcinoma that lives in the liver is probably a little more common than lymphoma. And hemangiosarcomas can live in the dog livers, and that's not uncommon either. That's actually a blood-borne tumor, and it can be anywhere, but it commonly will be in the liver. And again, if you're looking at these sonographically, there's really no way to definitively tell the difference, although there's some hints that we will talk about here in a second that will give you a little bit of an idea. But the only way to know for sure, you have to aspirate or to biopsy. Okay, so this starts this section here. Here's liver. And this is, we're going to try to tell by looking at it, is it benign or malignant? And I will, preface that with saying sonographically, there is no way to know if it's benign or malignant by looking at it. Although by looking at some characteristics of it, I can hedge my bet. I can make an educated guess that may help advise the owner on what do we do next. Okay. So how do we tell by looking at these nodules or mass lesions inside whatever organ we're talking about if it's most likely to be benign or most likely to be malignant, realizing it's not perfect and we're still going to have to put a needle in it. Okay. So if I look here, here's a piece of liver down in here. Okay. Falciform fat up here. Here's a diaphragmatic margin. Here's stomach sitting back in here, but he's got this abnormal kind of hyperechoic nodule in the liver. And again, I can describe the hell out of it. Okay, I can measure it. So I would measure, put a caliper from here and go across here, and I can say it's 1.5 centimeter or whatever that would be. I can say the margins of it are not that well defined. Okay, it's kind of poorly defined over here and over here where normal looking liver is, and then this nodule starts. And then if I look inside, if I kind of just pay attention to the nodule itself, is the nodule itself, does it look homogeneous? Does it all look the same, or is it kind of heterogeneous in appearance? And to me, it's got some little hypoechoic areas in it. There's a little small one here, there's another one here. So to me, it's pretty heterogeneous in appearance with kind of poorly defined margins. It's pretty round in shape. And so those are the type descriptive terms that we're going to use to try to help us decide and at least make an educated guess. Is this thing most likely benign or most likely malignant? And so whenever I see nodular disease, if it's in the liver or spleen or kidney or wherever it is, this is what I try to keep in mind. And again, the only way we're going to know for sure is to biopsy it, get cells out of it, look at it under the microscope. Okay, so things that would lead me in the appearance of a nodule to most likely it's going to be benign is if that nodule is round to oval in shape, if it has well-defined margins, most of the time that's going to lead you to think maybe benign, okay? If it's non-cavitary, so what do I mean by that? It doesn't have portions inside the nodule that are black or severely hypoechoic. In other words, a lot of these tumors that they get, those tumors outgrow the blood supply in the middle of that nodule, and that part of it dies and it becomes liquid. So it becomes hemorrhage and pus inside this malignant tumor and causes a cavitary appearance, meaning really hypoechoic to anechoic. Okay. So if it's non-cavitary, we like to see that. That's more chance it's going to be benign. If that entire nodule is homogeneous, so the entire nodule all looks the same echogenicity, it's more hypoechoic, or it could be more hypoechoic to the surrounding liver, but inside the nodule itself, the whole thing looks very homogeneous. That's most likely going to be something that's benign. In general, if the nodule is next to the capsular margin or the outside margin of the liver or spleen, if it doesn't bulge the capsular surface, most of the time those are going to be benign. Okay. If it does bulge the capsular surface and causes a big concavity and distorts the capsular surface, sometimes that means they're so fast growing that they bulge the capsular surface and they're trying to break out of that confines of that organ. Okay. In general, if there's one or two of them and they're all small size and about the same size, most of the time they're going to be benign. Okay. If they're larger in size and they're variously sized, most of the time they're going to be malignant. Okay. So this is just a little chart you can use to help you kind of get an educated guess if this is going to be, what's the next step to try to help these owners decide what to do. Okay. So if I'm looking at this mass, this is inside the liver of this animal, and I look at this mass. Here's kind of normal looking liver here. There's looks like part of a portal vein, little faint white walls around it. So normal looking liver, kind of around it, there's another portal vein coming up here, white walls. Okay. But then I've got this obvious abnormality inside the liver. Okay. It's cavitary because it's got these areas in it that are pure anechoic, may have some flocculent debris, cellular debris floating in it in here. Okay. And then so I kind of run down that laundry list. Well, is this thing that I'm looking at, is it perfectly round to oval in shape? And pretty much anything but that. Okay. It's very irregular in shape. Okay. Does it have well-defined margins? Well, in general, no. Up here, it's pretty well defined. Okay. But down here, it's ill-defined. I can't tell you if this is disease of the liver next to it or part of this mass. Okay. Down in here, it's really lacy and extremely poorly defined. Over here, it's kind of well defined over here, but poorly defined in this area. So the entire thing overall, I think, is relatively poorly defined. So far, I have poorly defined, irregular margins, and it's not perfectly round to oval in shape. Okay. And does it look like it's got debris and stuff? Yeah, it's got some of this weird echogenic tissue that's making up part of this cavitary looking ill-defined mass. So if I had to bet on that, am I going to bet most likely this is malignant or most likely this is benign? And obviously, because of those descriptors that we just talked about, I'm going to bet most likely this is going to be some type of malignant mass, and it may also be infected. Some of this may be pus that's starting to form inside this suspect neoplastic mass because it has outgrown its blood supply and the internal parts of it are starting to die and necrose. Okay. But how are we going to know for sure? The only way we're going to know for sure is we're going to have to put a needle in it or biopsy it and get chunks of tissue out of it. Now, let me ask you this. With ultrasound guidance, we can be really exact with some practice on exactly where in this thing, because we can actually physically watch the needle go into it as we introduce the needle into it. Where would you think would be the best place to put a needle to give us the highest diagnostic reward likelihood? Okay. Do you think it would be, we're going to get a high diagnostic likelihood of putting a needle into this black area over here or over into this kind of lacy looking tissue, maybe here or right here? Okay. The blacker the thing is, means there's more and more with ultrasound, there's more and more fluid in it. Okay. So there's a good chance this black area here and over here and even down in here, if you put a needle in it, you're going to get a combination of blood, hemorrhage, and maybe some pus. Okay. But you may not get neoplastic cells, even if this is a neoplasm. Okay. So the best place to or situate your needle would be one of these hypoechoic areas that have some meat to them. They have a little bit of lacy meat to them, and it's probably liver tissue that's being destroyed by this thing. And so that's the areas where you're probably going to get your highest diagnostic yield is not in a pure black area. Okay. What about this mass here? I see another mass. Here's looking normal looking liver over here. Here's the diaphragm. But now I have this mass or nodule inside the liver here. So again, am I going to bet this thing is benign or malignant? Well, this one is kind of half and half. It doesn't really read the book one way or the other. So you're kind of 50-50 toss up on this one. Okay. So if I look at it, it's kind of round oval in shape. Okay. The outside margins are relatively well defined. Okay. So those two things would think, it's a good chance it's benign. But if I keep going down my list that I think about, inside this mass itself, is it homogeneous or is it heterogeneous? And to me, it's really heterogeneous. It's even got a cavitary center in the middle of it. Okay. So it's got some things that make me think malignant. it's got some things that make me think benign. So there's no way I can tell. Okay. So this one, I'm on the fence. 50-50 toss up. The only way you're going to know for sure would be put a needle in it. And again, the place you want to situate your needle is not here in the black area. It's here in the outside thicker area around it. That's where you would want to get your aspirates. And hopefully you'll get some cells that will give you a hint. Is it benign or malignant? Okay, so why is it important? Some people would think, well, why is it important to make a bet and hedge sonographically if you think it's benign or malignant when you're going to have to put a needle into it and get cells out of it to know for sure one way or the other? So why even bother to guess? Okay. And the reason is because a lot of times that's what's helpful to guide you and the owner to what do you do next? Okay. So if I'm looking at this and I think, there's a good chance it's malignant and we need to put a needle in it to get those cells out, then you can advise the owner, the only way we're going to know for sure, I really do think it's malignant, but we're going to have to get some cells out of it to know for sure. Okay. Well, that owner may choose then, well, if you really think it's malignant, like that last one we looked at, then I'm not sure I want to spend the money to do that, or I'm not sure I want to put my dog through it, things like that. If you think, well, I think most likely whatever I'm looking at is benign, then the owner also may decide, if you really think it's benign, then I don't think I want to put a needle in it, and the other option you can give the owners for both of those scenarios, if they don't want to put a needle in it, be aggressive and get a diagnosis, then you can also offer them, well, the other option you can have is let's get your dog back in 2 or 3 weeks and re-ultrasound it. And let's relook at it and see if it looks different. Is it bigger? Is it smaller? Is it more cavitary? Is it progressing? Is it going away? And that will help them decide also. So it's kind of nice to know, and at least get in your mind if you think it's going to be malignant or you think it's more likely to be benign, because you can help advise the owner on what's the best next step to do. Okay. What about this liver here? And your first thought should be, what liver? Well, this whole thing was the liver at one point in time. Okay. But this liver has numerous large, irregularly shaped, heterogeneous, solid appearing mass lesions all in the liver. And it's also got multiple variously sized cavitary heterogeneous mass lesions elsewhere inside the liver. I don't see heart, maybe right in here, maybe a little bit of kind of normal looking liver, but not much of it all in the way of any normal appearing liver. So again, if you're going to advise the owner on this one, you're going to say, you should always keep in mind the signal of the dog. And so, especially if this is an older dog, say he's a 10-year-old dog, and you look at the liver like this, and the dog has clinical signs, he's not eating, liver enzymes may be up, then you're going to tell the owner, based on there's no normal looking liver left, I think there's a really, really good shot this is going to be really bad diffuse cancer of the liver. What the name of the cancer is, at that point probably doesn't even really matter if the whole liver is affected. And so, then you can advise the owner, we can stick it if you really want to know for sure, or it looks so bad, maybe we don't need to stick it. On the other hand, what's one of the next steps that you would advise, that you should advise, I should say, the client? If you see something like this, or even one of those other nodules we just discussed inside the liver, is if you suspect there's a chance this could be some type of cancer, before I would even stick it and put a needle into it and waste the animal's money or put the dog through that event, the first thing I would want to do is let's get some x-rays of the chest. Let's look at the lungs. And let's make sure that the dog doesn't already have metastasis and nodules in the lungs. Because if he's already got metastatic lung disease, then we don't need to stick this. We know it's going to be a cancer. It's probably a primary tumor. It's already metastasized to the lung. And there's really, in veterinary medicine, there's really no need to biopsy it at that point because the prognosis is really poor. Contrast, on the other hand, if this was a human. If this was a human, they would still biopsy it. Even if you had metastasized to the lungs, they're probably still going to biopsy it because they want to know what cancer it is, what's the best way to treat the dog with chemo, what's the best way to treat it going forward, even knowing the prognosis is going to be poor. And therein lies some of the differences in the ethics and what decisions are made on the human side as opposed to in animals. Animals, you're going to get some owners that still want to do that. And you should always leave the decision up to the owners. Okay. It shouldn't be your decision. It's not your animal. And some owners are going to want to go all out just like it's a human, and they don't care. They want to get a diagnosis. They're going to go see the oncologist. Let's put the dog on chemo or radiation therapy or whatever would be more effective based on knowing exactly what kind of cancer this is. Okay. But a lot of the owners are going to say, enough's enough. We don't need to spend any more money on this animal, knowing the prognosis is going to be really horrible. Okay, here's another example. So here's gallbladder, here's liver, and I can see there's this little ill-defined kind of round, but little irregular in shape, hyperechoic, solid but heterogeneous nodule in the liver. It'd be real easy to put a needle in it, look at the cells. On the other hand, you should give the owner the option. If you don't want to put a needle in it right now, then all we got to do is get the dog back in 2 or 3 weeks. We'll relook at that area of the liver and see if it's bigger or smaller than it was to begin with. If it's bigger, then you probably need to stick it to see what it is. If it's smaller or gone away, then you're probably done. There's a condition that happens in livers and spleens called nodular regeneration. We touched on that in one of the other lectures. And nodular regeneration inside the liver is a focal area of cells inside the liver that decide they are going to regenerate and make new liver cells. And while they're in the process of regenerating new liver cells, those nodules can become hyperechoic or hypoechoic. Okay. Typically, nodular regeneration inside the liver or spleen, you may have multiple nodules, but most of the time they're all going to be about the same size. And you won't have 100 of them, you may have 2 or 3 of them. Okay. So nodules in the liver or spleen that are about the same size, they're all relatively small, and they're either hyperechoic or hypoechoic. There's a good chance those are going to be regenerative nodules. And if you watch them over time, they will go away. Okay. On the other hand, if you see a bunch of nodules all over the liver or the spleen, and they're all variously sized, you have some that are really big and some that are really small, and they're more cavitary in appearance, there's a good chance those are going to be malignant. But again, the only way to know for sure would be either put a needle in it, look at the cells under a microscope, or get the dog back or the cat back in 2 or 3 weeks and re-look at those suspicious nodules and see if they have changed, if they're bigger, if they're smaller, they're more numerous, or they're gone away. Okay. Lymphoma in a dog or a cat. Lymphoma most of the time will affect the liver or spleen diffusely. Okay. And if you have very early or mild lymphoma, sometimes the liver, again, is one of those disease conditions that affects the liver or the spleen diffusely. So the entire organ is affected. But early on, it may not have enough sonographic changes in it to be able to recognize that there's something wrong. Given time, it will usually form this nodular kind of hypoechoic nodules all over the liver, kind of a honeycomb-like appearance of the liver. And again, that's not normal, and the only way to know for sure would be put a needle into it and look at those cells under the microscope to tell you specifically what diagnosis to make, or what's the specific diagnosis. On the other hand, if I see any abnormality in the liver or spleen or any other organ that, again, makes you think it might be cancer, it's a middle-aged older dog, probably a good thing to do ahead of time is get some chest films. Let's rule out the dog doesn't already have nodules in his lung. Here's another dog here. And again, look at these. If you had to bet, here's liver. This is all liver here. That's the stomach right in here. But there's this large, irregular, hypoechoic, heterogeneous nodule kind of bulging the capsular surface of the liver here. There's a large heterogeneous capsular nodule inside the liver here. There's another one down in here. There's one that's sticking out here next to the stomach. The margins of the liver are irregular in shape up in here. So again, would you bet that this is going to be something that's benign or something that's malignant? And again, because it is changing the parenchyma of the liver so much, we've got characteristics of it being malignant. It's bulging the capsular surface, multiple nodules, various sizes, heterogeneous throughout the liver. There's a really, really good chance this is going to be malignant. Again, probably before I would even advise the owner, let's stick it, let's get some cells. We want to know for sure if it's liver. Probably the best thing to do in veterinary medicine is let's get some chest films. Let's make sure that it hasn't metastasized to the lung. Okay. And again, this is the nodule we saw before. This one, I probably wouldn't even stick if it was my dog. I just wait, look at it down the road, in 2 or 3 weeks. Let's see if it changes. On the other hand, we got this nodule in the liver here. It's heterogeneous. It has poorly defined margins up in here. It's bulging the capsular surface of the liver. There's a really good chance this is going to be malignant. Okay, I don't know that for sure, and I have to put a needle in it to know, but it's got more malignant characteristics than it does benign characteristics. Okay, cat liver with lymphoma. Okay, lymphoma in a cat liver most of the time will cause the liver to become diffusely hyperechoic, very similar to what you would see with cats that have hepatic lipidosis or fatty liver disease. Okay, the difference is we said with cats with hepatic lipidosis, most of the time the liver is normal in size to just slightly enlarged. Cats with hepatic lymphoma, their liver becomes huge. Okay. And if you palpate the cat, you can easily feel the enlarged liver. And that liver, most of the time, is like rock hard when you palpate it. Okay. The only way to know for sure would be put a needle in it. But hepatic lymphoma in a cat looks very much like hepatic lipidosis, except lymphoma, typically the liver is huge. With hepatic lipidosis, the liver is normal to just slightly enlarged. Okay. Here's the dog. Here's radiograph lateral view. Okay, what do you think now that you've had abdominal radiology? What do you think? Is this liver in here? Do you think this liver is round and multilobular and enlarged, or is this liver normal in size and shape? Okay, and I would go with probably the liver is abnormal. It's really big, it's multilobular in appearance. Okay, and so there's a good chance, especially if this dog is middle-aged to older, that whatever we're looking at could be cancer. Can't tell you that for sure. So let's ultrasound the dog and let's look at the liver. Okay. So if I ultrasound, it's got this large multilobular hyperechoic kind of mass in the liver here. It's got a little free fluid right here, probably. The rest of the liver doesn't look normal either. It's kind of heterogeneous in appearance. So the next step would be, well, we want to stick the liver, but we would probably advise Dinky's mom or dad that, before we stick the liver, why don't we just get some chest films and let's look at the chest and make sure that even though the liver looks like this, let's get some chest films and make sure it hasn't metastasized to the lung. Okay. If you take the chest films and the nodule, there's no nodules in the lung and the lung fields are clean, then that's when you would probably go back and biopsy it. The next slide is a non-specific liver. Here, the liver doesn't look too bad. The margins still taper nicely, but it looks a little mottled, a little more mottled than it should. It's got a couple little hypoechoic nodules. This part of the liver looks more hyperechoic than this part. It's kind of mottled in appearance. And so I just described this as an infiltrative liver disease appearance. It's non-specific. There could be 20 different things this could be in the liver. And you'd have to put a needle in it to know. Some of the things that can cause the liver to just be diffusely kind of hyperechoic and mottled in appearance would be even cancers like lymphoma or mast cell disease, those cancers that sometimes will affect the liver and diffusely and cause the liver to look abnormal diffusely, but no discrete mass lesions or nodules. Okay. There's other things like hepatitis, an infection of the liver. Okay. Or steroid hepatopathy. Cushing's dogs with Cushing's liver sometimes will get hyperechoic and they become enlarged and kind of mottled in appearance. Or if they've been given chronic administration of Rimadyl or Metacam or one of the nonsteroidals, they've been on that for years. Then overall, that over time, that nonsteroidals can become hepatotoxic and they cause the liver to look somewhat abnormal, but not discrete mass lesions. Okay. And then we looked at this slide before. This is that cat revisiting us from the abdominal radiology lectures. And I can see there's these cololiths. So these are sand-like stones inside the gallbladder. And these little linear things we said are in the intrahepatic bile ducts extending into the periphery of the liver. These are called, as a reminder, choledocholiths. Okay. And sonographically, sometimes we can see those inside the liver. Okay. And if we look at those inside the liver, they're little focal areas of mineralization. So here's our liver here, here's our liver here. And we can see these little focal areas of hyperechoic mineralized tissue. And we know they're mineralized because they cast posterior shadows. So the sound is coming from the probe here into the liver, but now it hits this little area of stone or mineral opaque stuff inside the intrahepatic bile ducts. All of that sound is reflected back towards the probe, leaving no sound to extend further distally, and it causes the shadow. Okay, so these are choledocholiths inside the bile ducts of a cat or a dog. And for the most part, these are typically incidental. We don't recognize them as really causing any pathology at all or any pain. Okay. Okay, then we'll end today with gallbladder. So the gallbladder, remember, is one of those organs radiographically you don't typically see, but we have to know it's there. And it lives in the right cranial abdomen and surrounded by liver tissue. Okay. Well, with ultrasound, we can see the gallbladder in every case, unless it's been removed, or sometimes if it has nothing in it. Okay. So the gallbladder in a typical animal looks like a cyst. It basically is a cyst. It's a thin walled structure that contains bile. And bile, typically normal bile, a lot of times will just be pure anechoic. So it looks like a cyst. Okay. So the gallbladder wall is round to oval in shape. It has the nice thin wall filled with anechoic fluid. All of those things is what we use to define a cyst. Okay. Inside the liver, we can see, or inside the gallbladder, it's variable in size. So sometimes the gallbladder is big and sometimes it's small. And some of that is dependent on when the animal last had a meal. Remember, there's a hormone that is excreted after you eat, especially a fatty like meal, that causes the gallbladder to contract. That hormone, if you remember, is cholecystokinin. And that causes the gallbladder contract. So if you just had a meal, if the dog just ate a fatty like meal, especially, the gallbladder may be really small and not have much in it. On the other hand, if they haven't eaten in a while, the gallbladder may be pretty big and filled with fluid. Okay. Normally, you don't see the bile ducts. So you'll see the gallbladder, but in a normal dog, you cannot follow the bile duct down to the duodenum. So here's a normal looking gallbladder. So here's liver rounded here, there's stomach. This is the diaphragm. This whole big cystic looking thing is the gallbladder filled with anechoic fluid, nice thin wall. Okay. Here's another gallbladder, but this time it's very minimally distended. So the animal probably just ate. The gallbladder has very little of stuff in it. That's the neck of the gallbladder. Okay. What are some disease conditions that happen with the gallbladder? Well, commonly you will see little debris inside the gallbladder, and these are little stones inside the gallbladder. Okay, so there's this little faintly shadowing, irregularly shaped stone that lives inside the gallbladder. Okay, so stones in the gallbladder is called a cholelith, or cholelithiasis is a condition where stones are in the gallbladder. Okay, biliary stones, gallbladder stones, or cholelithiasis in dogs and cats is not uncommon, but unusual because, as opposed to people, they rarely cause a clinical problem. Okay, stones in people a lot of times will pass out in the bile duct and obstruct the gallbladder. Okay, and even then, those stones in people will cause over time an infection, and they irritate the inner margin of the gallbladder, the mucosal surface. Okay, most of the time, when you see stones in the gallbladder of dogs and cats, they're typically incidental. Okay. Gallbladder sludge is a collection of thickened bile. In this case, it's got also some little faint shadowing stones in the neck of the gallbladder. When you see sludge inside the lumen of a gallbladder of a dog or a cat, typically, if it is gravity dependent, in other words, it's settling down due to gravity like a snow globe would, typically that's going to be incidental. If I look at sludge inside the gallbladder like this, here's a gallbladder here, and there's sludgy crap inside the gallbladder. So this is inspissated thick bile in here. It's gravity dependent, it's non-shadowing. Okay, there's a little bit floating up in here inside the gallbladder, but most of the time, if you see gravity dependent sludge inside the gallbladder of dogs and cats, it's an incidental finding. And I would bet 90% of dogs have this. Okay, doesn't matter the age. And probably half the cats will have a little bit of sludge in their gallbladder. Apparently, in people, that's worrisome for a gallbladder infection. But in dogs and cats, at least that we recognize, it's an incidental finding. Okay. If you start to get sludge that's more suspended and it doesn't settle out due to gravity, then we start to worry about, let me go back to this slide here, and we're going to do this and then go back to there. Then we start to worry about these things called a biliary mucocele. Okay. Have you guys heard of a biliary mucocele yet? Probably not. Well, biliary mucoceles is severe thickening of the bile inside the bile duct to the point that it becomes solid and it becomes crystalline. So it's almost like they get a bunch of dried up cement inside the gallbladder. And if you cut these out and you remove them, which a lot of them will have to be surgically removed, you can actually roll them around on a table or around the floor. If you cut through them, or they're really gritty, and they have these like stellate crystal spokes that extend to the edge of the gallbladder. And you can see here that people will term those as a kiwi fruit variety biliary mucocele. So you can see this is all a gallbladder here, and it's chock full. It's not gravity dependent, but it's chock full of all this debris inside the gallbladder, and it's forming these radiating stellate looking spokes out into the periphery of the gallbladder. Okay. This is called a biliary mucocele. This kind is the kiwi variety. There's other kinds that people term the honey bun variety, where you don't see the spokes, but the gallbladder is chock full of this non-gravity dependent debris. Okay. And these dogs that have biliary mucoceles, they will come in and they don't have specific clinical signs, but they're not eating as much. You pick them up and they seem painful. Their liver enzymes will be moderately elevated. You know, they're just not thriving very well anymore. And so because of the liver enzymes, you'll ultrasound the abdomen, you'll look at the liver, and you might see one of these biliary mucoceles inside the gallbladder. For the most part, and there's differences of opinion on this, but how do you treat these dogs? If it is a non-kiwi variety biliary mucocele like this one here, that is a poorly defined swirling honey bun like biliary mucocele, the internists, of course, are going to say, well, let's treat the dog with different diets. Let's put them on antibiotics. Let's put them on medication. There's one ursodiol that will thin the bile and try to dissolve whatever sludge this is over time. That may take weeks to even a few months. You keep looking at with ultrasound, see if it's getting better. Okay. In my experience, if a lot of times, even if you treat these dogs medically, this will progress and eventually it will look like this, a kiwi fruit variety mucocele. In my opinion, and most people's opinion, that if you get a kiwi fruit variety mucocele in the gallbladder of a dog, that usually needs to come out surgically, and they'll have to go in surgically, look at the gallbladder wall. Sometimes it's getting ready to rupture or tear, and you have to take either the biliary mucocele out if the gallbladder wall still looks fresh and it looks viable. On the other hand, sometimes the gallbladder wall is so friable it's getting ready to tear, and then you have to take the entire gallbladder itself out along with the mucocele. Okay. So what I want you to know is biliary mucoceles is non-gravity dependent sludge inside the gallbladder. The more severe ones take on a stellate-like appearance. If you see biliary mucoceles with a stellate-like appearance, most of the time those dogs need to go to surgery and have the mucocele itself removed or the entire gallbladder removed. Most of the time for a GP, that's beyond what you're probably going to be comfortable doing, and you're going to refer that to a soft tissue surgeon in a specialty center. Okay, going back a little bit, this gallbladder wall, normally it should be thin and smooth. This one's really thick in appearance all the way around the gallbladder wall. So that would be a sign of an infection of the gallbladder. So the wall itself is edematous. It's probably infected, and it causes it to become thickened in appearance. And again, these animals come in, they're painful. They probably start to vomit. Their liver enzymes are up, and you see a thick-walled gallbladder wall. Sometimes the infection will produce gas-forming bacteria, and now you don't see the gallbladder wall, but you see a gas bubble inside the gallbladder, which causes shadowing because, again, ultrasound doesn't penetrate through gas. And when that's the case, then you'll see a little arcing hyperechoic area with shadowing below it. And that's usually due to gas accumulation in the gallbladder itself, or an emphysematous cholecystitis due to a gas-forming bacterial infection in the gallbladder itself. Sometimes, rarely, these stones that can live in the gallbladder, they will pass out of the gallbladder down the bile duct and get stuck. Okay. And this is a stone that did that. So it eventually at some point was in the gallbladder, but then it decided it needed to move and it passed down. This is the bile duct leading to it. A normal bile duct, again, you don't see, but if it becomes obstructed due to a stone or sometimes a cancer or tumor that's compressing the lumen of the bile duct, then in this case, we see the stone, it's casting shadowing, so it's mineralized and it's stuck in the bile duct. okay? And the bile duct cranial to that area is going to be really dilated. The bile duct caudal to it, you're probably never going to see because it's not dilated, because nothing can get through past this stone, okay? If you see, and this is really pretty rare in dogs and cats for them to get a bile stone stuck in the bile duct. But if you do, there's nothing that's going to move that other than surgery to go in and remove it. And again, that's probably going to necessitate you turfing that animal to a specialist. Okay, I think that is probably it for gallbladder. Oh, here's one more slide. This is a bilobe gallbladder. Probably 20% of cats have bilobe gallbladders, which doesn't mean a damn thing. It's an incidental finding. They got two gallbladders sitting right next to each other. Doesn't mean anything. It's an incidental ooh-ah kind of finding. Okay, that's a good place to stop today. We're going to stop there. We'll pick up tomorrow morning and discuss spleens. How's that sound? I know it's a lot of information, but you know, be patient, try to learn it, study a little bit as you go before your next quiz. Okay, I will see you guys in the morning at 10. Thank you.
Thanks.
Bye.
Meeting.